Hello, good evening everyone. I am Dr. Dhathri, consultant in Obstetrics and Gynecology. So today I wanted to talk to you all about a very important and a common topic that most women do not come out and speak about, but it is very important. And that is why gynecological cancer screening matters. Why is it important? So what is exactly screening test, or why do we need to do it? So these screening tests are those tests, simple tests that are done basically even we develop the symptoms towards any disease. And that is why it is very important, because by doing these screening tests we would be detecting a disease before we even develop the symptoms. So now, what are the different gynecological cancers that we come across in our day-to-day lives? Starting from cervical cancer, which is the most common cancer in India in women, uterine or endometrial cancer, ovarian cancers, vaginal and vulvar cancers. So now when we come to the screening tests, we have seen that cervical cancer has been one of the most common cancer for which there is a very simple screening test developed, and it is across India, pan nation, even in the rural settings, in the government setups, we use a test called pap smear. It is also one of the easily preventable cancers which we all know by using HPV vaccination. Now when we come to other cancers like ovarian cancer and endometrial cancer, do we have any screening test for these? So there is no generalized screening test for these cancers, that is uterine or endometrial and ovarian cancers. Then how do we screen women for such cancers? So before we even develop symptoms like any abnormal vaginal discharge or chronic pelvic pain, any history of abnormal uterine bleeding or bleeding after intercourse, so these are the certain symptoms that we usually come across or women experience when such cancer symptoms are seen. So for ovarian cancers, we usually tell, pelvic scans can be done, or serial blood test monitoring, that is called tumor markers, that is CA-125 can be done. But these are not routinely recommended for everyone. For endometrial CA also, for uterine cancers also, generalized endometrial biopsy screening is not recommended. But when is it actually important, and for whom is it important? When there are already high risk factors. Like for example, for ovarian cancers, when there's already a strong family history of ovarian cancer, then definitely if your mother or sisters have already had ovarian cancers in the past, it is very important for you also to get a 6-monthly or annual follow-up pelvic scans done, and also CA-125 blood tests. And if you are a postmenopausal woman with any postmenopausal spotting or bleeding, then definitely getting a pelvic scan done and endometrial biopsy is required, especially if you are on the obese side, having medical conditions like hypertension and diabetes. These are the different risk factors for endometrial cancer. So if any of these risk factors that are there in you or your family members, then definitely advise them and go to a gynecologist and consult them. Do not get scared just by the word cancer. You might not have it, but it's always advisable to get screened for it and detect it early, because early detection always have a better outcome and the management is better. So what I would like to convey to all of you, the first most thing is screening is very important. So definitely get screened for yourself for cervical cancer, be it pap smear, get yourself vaccinated by HPV vaccination. And if you have a family history, like I had mentioned, why I'm actually coming to this important topic, this episode, this live session, is because in the past few weeks, we have already seen patients who've had ovarian cancer in their families, They've got a follow-up scan done initially, but were never recommended further blood tests and further evaluation. And also many women in the postmenopausal age group who are already obese, who are already hypertensive, they would not know the risk of getting endometrial CA. So keeping all these things in mind, I wanted to, actually emphasize the fact why screening is important for gynecological cancers in India. I hope this bit of information has been useful to all. Thank you for joining in, and please do share this live video to every woman who around you and who has any such symptoms, so that they can visit their gynecologist at the earliest. Stay safe, stay healthy, and stay happy. Thank you.